Hey guys, and welcome back to another episode of 5 Minutes with Your Doc. Today we're going to be talking about male testosterone replacement therapy. Who needs it, who shouldn't have it, and what does it do? Stay tuned. Testosterone is a sex hormone that is produced in the Leydig cells of the testicle after receiving a signal from the pituitary in the form of luteinizing hormone. That then causes those cells to ramp up and produce testosterone, which has a variety of effects, including fetal development into a male, muscle density and lean muscle mass, bone density, bone marrow maturation, hair growth, and sexual libido and function. Testosterone levels should not be checked as a part of routine screening. It should be reserved for those individuals who are experiencing the signs and symptoms of low T. That includes loss of libido, erectile dysfunction, low bone mineral density, gynecomastia, which is breast production in males, and small testicles. Some less specific signs and symptoms are fatigue, reduced muscle strength, reduced muscle mass, and an increase in fat mass. You can also see some anemias in low testosterone levels. So who actually needs therapy? Not everyone with low testosterone requires treatment. If you are not experiencing the signs and symptoms of low T, it may be your body's natural state. The only individuals who qualify for testosterone replacement therapy are those with a testosterone level outside of the normal reference range and are experiencing symptoms. But the goals for testosterone replacement therapy are to improve sexual functioning and libido. It's also to improve lean muscle mass. Now, guys, it's not this fat loss miracle. Studies have shown that individuals who are obese who start testosterone replacement therapy do not lose an exceptional amount of fat unless they're on a diet and exercise program. However, it does help males to maintain a lean body mass over the long haul. And in either way, it increases that lean muscle mass. It can also increase bone mineral density. It can help with anemias if you are anemic. But that's also a caution, which we'll talk about here in the next section. So you've got low T. How are you going to treat it? Well, there are actually quite a few different options. There are exogenous options, which means that it's produced in a lab. Testosterone's produced in a lab, and you can inject it or absorb it through your skin or the inside of your mouth. Or you can do my favorite, which are endogenous methods that make your body produce the testosterone on its own. Those options include clomiphene, which actually was a female fertility drug, but it causes an increase in luteinizing hormone, which in turn stimulates the testicles to produce testosterone. And it does it in a way that doesn't affect your fertility, like injections do, and it doesn't cause testicular atrophy like injections do in the long haul. Other things are breast cancer treatments called aromatase inhibitors. Those prevent the conversion of testosterone to estrogen in the body. And HCG has been used as well. It does a similar function as clomiphene, and it increases the level of testosterone through increasing LH. However, it can be used with injection testosterone in order to preserve fertility in men, though it's not my favorite option. In this last section, let's talk about some old ways of thinking and some major contraindications for testosterone replacement therapy. Now, it used to be said that testosterone supplementation will increase your risk of prostate cancer and will increase your mortality from cardiovascular disease. Many new studies have shown this to be absolutely false. It may actually improve your cardiovascular outcome in the long haul. And new studies have shown that it does not increase your mortality from prostate cancer. However, it does still contain a black box warning and a contraindication for use in individuals with prostate cancer, and I think that's a safe bet anyway. Now, actual specific contraindications for the use of testosterone replacement therapy include prostate cancer, as we said, Breast cancer, because testosterone gets converted to estrogen and that can have an effect on breast cancer. Erythrocytosis, increased red blood cell count, that's way too high. Can't take testosterone. Severe untreated sleep apnea and heart failure. So heart failure is a contraindication due to sodium resorption and increased muscle mass, adding extra stressors on the heart. Also, if you are prone to DVTs, testosterone replacement therapy probably isn't for you. Well, that wraps up another episode of 5 Minutes with Your Doc. Thanks for joining me today. If you have any questions for me about hormone replacement therapy or any other topic, please feel free to comment below or give me a call or visit my website for any other further information. That's to follow. Thanks. Bye-bye.